I am a consultant hematologist. I specialize in the diagnosis and treatment of blood and bone marrow disorders. The aim of this short film is to provide some basic information about classical Hodgkin's lymphoma. A new diagnosis can be overwhelming, and it can be difficult to take in all the information given during the first consultation. This short film will hopefully give you the core facts about what is Hodgkin's lymphoma, the symptoms and signs of Hodgkin's lymphoma, the tests and investigations required for the diagnosis and assessment of Hodgkin's lymphoma, the treatment options available for Hodgkin's lymphoma, and brief guidance on living with Hodgkin's lymphoma in general. I hope that following this discussion, you will be empowered with a better general knowledge of classical Hodgkin's lymphoma. This, together with a strong relationship between you and your treatment team, will enable you to understand your disease and its management better. Classical Hodgkin's lymphoma, also known as Hodgkin's disease, is a type of cancer of the lymphatic system. The cancer develops from a type of white blood cell known as lymphocyte. The cancerous lymphocytes increase in number within the lymph glands or other tissues, which then causes enlargement or swelling of the lymph glands. There are different subtypes of Hodgkin's lymphoma. The exact subtype is determined by the microscopic appearance of the biopsy tissue. However, the treatment principles are similar for various subtypes. Hodgkin's lymphoma usually presents as a painless swelling of a lymph gland in the neck, armpit, or groin. The lymph glands are also found normally in the chest and tummy. Their involvement will lead to swellings within the body, which can be picked up by special scans. The swollen glands may be the only symptom in significant proportion of patients. However, in some cases, a person may experience a dull ache or pain in the swelling, which may be made worse by ingestion of alcohol. Other patients may have symptoms like fever, drenching night sweats, weight loss, and excessive and persistent itching. These are known as B symptoms and are often associated with advanced disease. In some cases, the disease can involve the bone marrow and upset the growth of red blood cells, platelets, and other white cells, which can result in symptoms of anemia, bleeding tendencies, and infections. The diagnosis is made by a specialist looking at the biopsy sample of the swollen lymph gland or tissue under a microscope. You will also need to have a CT scan of your body to see if other lymph glands are enlarged in order to assess the extent and bulk of the disease. A special type of scan called PET scan may also be done. The PET scan is more sensitive in picking up disease even when the lymph gland may not be very enlarged. A bone marrow biopsy will also be performed to see if the lymphoma has spread to the bone marrow. Other blood tests to check the function of kidneys and liver are also done in order to plan treatment. You may also need to have tests of your heart and lungs as part of the planning for the chemotherapy. Tests for chronic viral infections like HIV, etc. are also done to complete the assessment. There are very effective chemotherapy treatments available for Hodgkin's disease, and with these, the disease can be cured in a significant proportion of the patients. The chemotherapy program is selected based mainly on the age and fitness of the patient and the extent or bulk of the disease. There are a number of different options of chemotherapy which make it possible to tailor the treatment to the patient's needs and ability to tolerate chemotherapy. The exact pattern and duration of your chemotherapy will be explained to you by your specialist. The chemotherapy can damage cells of reproduction. If you are thinking of having a family after the chemotherapy, you should discuss with your specialist the option of reproductive cell storage prior to chemotherapy. You will have regular follow-ups throughout the duration of treatment and for a period after the completion of your treatment. Your specialist team will perform blood tests and scans as appropriate to monitor your response to the treatment. Radiotherapy may also be required as an additional treatment in some cases. The decision to use radiotherapy is made by your specialist and will be explained to you if you require it. Most patients with Hodgkin's lymphoma have a good life expectancy and can enjoy a normal life after treatment. A significant proportion of patients will be cured after completing the first set of chemotherapy treatments. In a minority of patients, the disease may come back, and there are good treatments available for relapsed disease also. You will need to have regular follow-ups even after completing your chemotherapy, and these will be arranged by your specialist team. It is important that you remain in regular contact with your specialist team so that you can discuss with them any recurrence of symptoms. As a significant proportion of patients are cured with treatment, it is quite likely that you may never have any recurrence of Hodgkin's disease after treatment. It is, however, important to maintain a healthy lifestyle to achieve a longer and healthier survivorship.